Almost everyone has been touched at some point by the physical, emotional, and financial toll of cancer, either directly or through a loved one. In fact, 1 in 2 men and 1 in 3 women will develop cancer in their lifetimes. Managing Cancer at Work was created to provide education and empowerment to employees who want to learn more about preventing cancer, as well as a unique support system for cancer patients and caregivers of cancer patients. Prevention and screening, which is important for everyone, is an integral part of the program. High screening rates are known to actually reduce cancer incidence. Following simple guidelines for diet and exercise will further diminish the risk of a diagnosis. There's even a personalized online tool that uses your age, gender, and personal risk factors to identify specific screening tests that you and your doctor can consider. Managing cancer at work can also be immensely important if you or a loved one have been diagnosed. It can help you manage health and family issues, as well as the uncertainty cancer can place on your career. The program allows you to access a comprehensive online resource that combines some of the best educational content available, along with videos and tools, to give you easy-to-understand information that you need to make informed decisions concerning work, should you need treatment. It also marks the first time a program of this kind has incorporated the services of Johns Hopkins Oncology nurse navigators, who act as a kind of personal coach during the entire cancer process to provide valuable information as well as emotional and practical support. Beyond vital cancer information, you'll find a variety of topics that deal with your workplace. There's advice and video demonstrations on how to communicate with your manager and coworkers if you're diagnosed with cancer, or need to act as caregiver for a loved one. The program will assist you in mapping out a plan of action with your manager for either of these cases. You'll also discover effective workplace strategies designed to help accommodate any limitations you may have due to your illness. And you'll learn about benefits and legal entitlements that might apply to you. In addition to the resources available to you as a patient, there's an entire section designed to help you thrive as a cancer survivor and for employee caregivers who are managing work and caregiving responsibilities. Because caregivers of cancer patients may see their work impacted just as profoundly as cancer patients themselves. Cancer affects us all, from screening and prevention strategies, dealing with a diagnosis, workplace issues, caregiver support, and the one-on-one support of a Johns Hopkins nurse navigator. The Managing Cancer at Work program has the expert advice you need.
I can't tell you how many times employees come up to me and thank me for having this benefit. We knew there was a need, but we had no idea how great a need until we actually put the program in place. I have an employee population of close to 12,000. When you look at the statistics of cancer, and then when you look at the number of our employees who are caregivers for someone who has cancer in their family, then you're talking about a tremendous number. Many of our benefits, if you want this piece, you go there. If you want this, you go to this office. And here's one where there's one phone call, there's one website, and it's just wonderful to have it as a complete package in one place. From the time you're diagnosed or from the time a family member is diagnosed, our nurse navigator is available, and they'll walk you through the steps and whatever your needs are, whether it be medical, psychological, just working, trying to figure out how to continue to work, because that's so important, because a lot of employees do want to continue working. The benefit for managers is huge. We have a website specifically where managers can go to identify some of the resources for them, because it's tough for them. They don't know how to balance sometimes the needs of the employees with cancer and the workplace, and what they can talk about and what they can't talk about, or what they should be talking to the employee about. I think it's changed the culture of the organization. It really has. People aren't afraid to talk about it anymore, and they understand that there are ways that you can work with individuals who have cancer and accommodate them in the workplace. And it's a win-win for both. I have employees, I have managers stopping me every day and talking about it. How did we ever survive without this? I mean, this is a no-brainer, and I congratulate the team who had the foresight to do this, and I thank this program every day.
When I got diagnosed, it felt like my heart fell out of my body. My supervisor, she's like, Jocelyn, here's a program that can help you. Managing cancer at work. And I was like, wow. I had worked previous jobs before, and none of the other jobs offered anything like this. I did have some interaction with the nurse navigator. When I talked to her the first time, she just listened. That was a big help. I was supposed to have been out for a whole year, but within 6 months, my boss called me and she asked me, would I come back and do some paperwork in the office? Even though it wasn't 40 hours a week, it was a steady paycheck. And that meant the world to me. And managing cancer work, that helped me a whole lot. This organization, for them to open up a program like this is awesome. I am truly, truly grateful.
Having a program like Managing Cancer at Work is a huge benefit to managers. With our busy and hectic schedules, it is just an absolute godsend to have that information readily available to us. We're able to self-educate. We're able to formulate our management strategies with information that is compliant with HR policy, and then share with the employee things we may have learned and have that frank and open conversation with them to make sure that their needs are met. Jackie came to me and she told me that she had had a recurrence of her cancer and that she was going to need intermittent treatment. We wanted to be flexible and meet both the needs of the employee as well as meet the needs of the institution. I wanted to make sure we could retain her because she is a good employee and she was a great fit for the department, and then help her balance her medical and work situation. If the employee is physically and emotionally capable, I think it's important for them to continue to work. It is mentally healthy for them to be engaged in activities other than just focused on their medical care. We want to make sure that there's a seamless transition between your short-term and your long-term disability. Managing Cancer at Work is provided a wonderful opportunity to have a two-way dialogue. She can come to me and say, this is the information I got. I can go to her and say, this is the information that I have received, and so that we have a wonderful two-way communication. Having that resource there available to us is extremely valuable.